Dini katika hekalu hapa Nyeri na vile vile Bishop Paul Wanjohi.
Jambo Temple Dairy. God prayer in Sankaya Surya Koti Shama Prabha Nir Sarvakari Shushai Shanti Ro Adaya Om Gau Shantiran Tarikshagum Deva Shanti Brahmanti Shama Shanti Redi Om Shanti
Wetu ni kwamba nakushukuru kwa kuamsha salama.
Of Kenya, Honorable Gachagua, all governors present, RCS, Interior, all protocols observed. Good morning, everyone. My name is Tobacco is also down there at 409, followed by cat 61, cannabis 45, prescription drug 8.8, which is also another concern. It's an emerging trend which is very worrying. Then multiple substances. This is somebody who is using more than one substance of abuse. Data from the region shows that the age between 25 and 35 years is the most affected, and as well as the biggest burden of addiction. The region is emerging as a key market for the hard drugs, just like you mentioned, Your Excellency, including heroin, especially in counties like Kiambu, Nyeri, and Murang'a. We are now finding heroin in these counties, and not only in big towns, even in the rural areas. Actually, out of these, we have a methadone-assisted center in Kiambu, in Karuri Sub-County Hospital, to assist those people already addicted to this and win out the problem of heroin. This table also represents the distribution of the alcoholic outlets within our counties. In Murang'a, this data we got it through the GAO. We have about 451 bars and restaurants. Bars and restaurants is another big challenge we have in our region, Your Excellency, because bar and restaurant license is one of the most abused licenses. People open early in the morning until late in the night. Realize that the GAO, the national government officers, sometimes in places, they are not involved in the licensing committees at the sub-county by the county governments. So the county government might license some premises which, in relation to security, where the OCS is supposed to give guidance, or issues of the public interest where the DCC maybe can give a word, they are not involved, and that's why we find maybe even the proliferation of the outlets. Then another challenge you have found is that we have a permissive society where in Central Region nowadays, it's becoming a trend that it's accepted that alcohol must be taken everywhere. You find people going to attend a burial in the morning, and even before they go to collect the body, they have passed through a place to take alcohol before they even. So that permissiveness is also another factor. Then early initiation to alcohol and drugs, because we are even doing these things in our homes. So even our children, they are also learning, and they try to test quite early. There's also an aspect of poor parenting, where many parents are not responsible. They are not taking their parenting responsibility as expected. Then we also have availability of highly potent substances of abuse, just like we demonstrated earlier. Then inadequate prevention, care, and support programs in the community, where the community is also supposed to have its own mechanism to protect and ensure that they have alcohol and drugs-free communities within themselves. Then we also have a challenge of lack of affordable treatment and rehabilitation service facilities. And allow me to mention here, sir, that in Central Region, it's only Nyeri County, and we want to once again thank you, the Governor Nyeri County, who have a public rehabilitation facility in partnership with NACADA. So, as we said, we also encourage the other counties to ensure that we have at least one rehab in every county so that we can rehabilitate our young people who need those services. In a summary form, the challenge, we can summarize it in, we look at the cause and the manifestation. The issue of licensing and enforcement, it is evidenced by the mushrooming of alcoholic outlets in undesignated areas, including residential areas, including inside the villages where they should not be licensed. We also have bars operating without licenses. And like we said, Your Excellency, if a bar can operate without a license, it means there's somebody who is maybe protecting it to operate. Then you also have the issue of abuse of licenses, the terms and conditions of license, like the example I was giving of a bar and restaurant. You find the price is not ideal, or they are not operating according to the terms and conditions of license. Then we have sale of substandard alcohol in unhealthy conditions, outlets operating beyond the stipulated hours, and also another big challenge you have here is wine and spirits dispensing on site, because wine and spirits are strictly supposed to be taken away. But you'll find there's a jug there and some water and some glasses. That 250 ml, two people can buy, they share, they take it there, they fresh, they call it fresh, and they go.
The Deputy President and all other protocols observed. Good morning. Good. Now, my name is Grace Wanjohi, and I am the Executive Director of Mulika Institute for Social.
Kana, ujumbe huu hautakugharimu chochote. Weka akaunti yako na mtaa ambapo uhalifu unatendeka. Mulika uhalifu. Ujumbe huu umeletwa kwako na Wizara ya Mambo ya Ndani na Uratibu wa Serikali ya Kitaifa.
Now, I think most of you have seen that, and you may have heard it in the radio. But the biggest question here is, ukiona, ukisikia, ukishuku, useme. Useme wapi? Useme aje?